I was approached by the Indiana Center for Advanced Medicine, and they are the first place in the country, and so far the only place, doing sonophotodynamic therapy, which is a unique alternative cancer treatment. And what we do in the practice here, we are IRB, that's Independent Review Board, certified to treat 3 different types of cancer. And I'll explain those in a minute because it becomes more apparent with what we're doing with the treatment. As you know, cancer cells divide rapidly. That's one of the ways that traditional chemotherapy treats cancer cells, is that it kills all of the cells that are dividing at any given moment, and the theory behind it is they kill more cancer cells than good healthy cells. What we do with sonophotodynamic therapy is something similar, but we approach it from a different method. The patient takes in a very specific type of chlorophyll, and what happens is all of the cells that are dividing at any given moment take up the chlorophyll. So very, very similar to chemotherapy. But we wait about 24 hours, and within 24 hours, most of the healthy cells have processed and excreted the chlorophyll. But the cancer cells have a harder time doing that, so the chlorophyll stays in the cancer cells longer. So after 24 hours, we begin therapy with sound, and we use ultrasound, and it's at a very specific frequency that activates this particular type of chlorophyll. And then we use light, and again, very specific frequency that activates this particular type of chlorophyll. And because the healthy cells have now excreted the chlorophyll, nothing happens. And in the cancer cells, the chlorophyll does what it's supposed to do in nature. It takes carbon dioxide, which is the waste product of the cell, and converts it into oxygen. The oxygen becomes a free radical, and the cell basically gets deleted, it gets marked for deletion from having excess oxygen. So it's like a very targeted chemotherapy. And the nice thing is that because it's chlorophyll, there really aren't any side effects. You might, you might get a little green poop. That's about as bad as it gets because it specifically targets the cancer cells. And if we're doing our job right, we kill off a few cells at a time. So this is a treatment that takes a while. It's not a treat once and then forget about it. What we do is we take the actively dividing cells, those get killed. We come back the next day and we do some more treatment, and those actively dividing cells get killed. And then we come back the next day and do some more treatment, and those IRB approved to treat cancers basically we can reach with light. So breast cancer, because it's a surface cancer, in that it's not past the rib cage and in the organs. We can treat skin cancer, and we can treat prostate cancer. We've developed a probe that actually goes into the rectum where we can illuminate the prostate. And here in Indiana, we treat stage 1 and stage 2. That's fairly early cancer. Anything that's stage 3 or stage 4, we're not equipped to do inpatient work here. So this is all outpatient work. Patients that are relatively healthy, they have a diagnosis of cancer, but they don't need hospitalization. Anyone that would need hospitalization, we take them to a clinic in China, and they get treatment there. Same treatment, but it's actually an actual hospital that's set up for that. We believe that we have a better solution to chemo because it doesn't carry the side effects. You don't lose your hair and everything else. And you know, there's every belief that we get as good as results, or even better. So again, stage 1 and stage 2, theoretically these people are relatively healthy. They stay in a hotel that's close, and we treat them daily here for 2 weeks, and then we give them a home program and all the equipment to do that with, and they treat themselves for the next 6 weeks while we monitor them. But that means that they don't have to come here and stay for 2 months or 3 months or whatever it would take. Okay. Insurance will reimburse. What we do is it's typically a cash upfront payment. That way we're covered, and then we work with the billing agency, so everything that we do is detailed and sent to the billing agency to be submitted to the patient's insurance company. Currently, we have the capacity to treat 10 patients at a time, which would be, it's a 2-week treatment, so that's 20 patients a month. And of course, when we get to that point where the office is filled up because we're just beginning, then certainly we can expand office space and continue to treat more patients.